John Blake presents A Matter of Life and Death, written by Kelly Critcher and read by Colleen Prendergast. Author's Note: Although this audiobook is based on actual events, some names have been changed to protect the identity and privacy of those who form part of the narrative. To be taken into the heart of the front line in this book is harrowing, yet it is rewarding to share the honesty and dedication of those people saving lives and working so hard. I feel inspired and safe to be able to read this book and feel very much in the hands of angels. Chris Difford, singer, songwriter, squeeze and curator of the NHS album. Introduction. This audiobook is an insight into my life and my work. I have no agenda other than to tell my story. I mean no offence to anyone, so please don't take any. Have you, or has anyone you know, ever been called into hospital to have the conversation? The one that goes something like, "I'm sorry, we've tried everything possible, but things are not looking good." Lives change during those conversations. Hearts break. Worlds fall apart. Have you ever wondered what it might be like to have those conversations day in, day out? I would like to show you a little of my world and what it's like to be a part of someone's life at the most difficult time, when it becomes numbered in days, weeks, or months. For me, dying is just another phase of life, arguably the most important. Our last chance to do things we want to do, say things we want to say. But to do this, we rely on the bravery of healthcare professionals to fight their own fears and be honest with us, telling us painful truths, even if this means causing upset. I realised a few years ago that I had stopped coming home and relaying my extraordinary experiences to my family. What had started as extraordinary had become ordinary. Yet the things I see and do on a daily basis are fascinating. I was afraid that stories would go untold, lost forever as my memories fade. Some stories need to be captured, and I hope this audiobook gives some insight into what ordinary NHS staff do on a daily basis. For reasons of privacy, some names and details have necessarily been changed, but all the stories are true. I've been a nurse for 17 years. Having first gained a degree in business management, I realised that my heart lay elsewhere. It took me a while to get there, but once I did, I never looked back. As a student nurse, I was asked to visualise and draw what nursing meant to me. So I drew, badly, an apple core, to signify that nursing is at the centre of everything I do, everything I see, and everything I feel. I love being a nurse. I love my job. Starting my career in the acute sector, I was like a sponge, absorbing every bit of knowledge I possibly could, seeing patients at their most vulnerable, watching lives being saved on a daily basis, witnessing medicine at its best in all its glory. Yet, alongside the treatable, the curable, the survivors, are those patients whose needs often get pushed aside. The patients who won't get better, cannot be cured, will not survive, the palliative and the dying. I felt they deserved better, and the more I saw, the stronger my feelings became. Eventually, I took a giant leap in the world of healthcare, from acute to palliative nursing. Little did I know it then, but in March 2020, this combination of nursing specialities would come to the fore in the battle against COVID-19, a dangerous and fast-spreading virus that took the world by surprise and brought some areas of the NHS to its knees. In my audiobook, I take you into the world of Northwick Park, a major general hospital in Greater London. From my first days on the ward as a student nurse through to the recent coronavirus pandemic, there has never been a dull day. It is a place full of hustle and bustle, hosting a never-ending flow of people from all walks of life. Staff, visitors, patients, relatives, carers, police officers, ambulance technicians, porters, nurses, doctors, physiotherapists, domestic staff, adults, children, mums in labour. The happy, the sad, the new parents, the recently bereaved. All joined together, experiencing the best and the worst of the healthcare system. Each with their own story to tell about our magnificent NHS, of which I am hugely proud to be a part.
Sample complete. Ready to continue?